Hello, welcome to the session. My name's Jackie O'Kelly and I'm one of the patient support officers from Action Bladder Cancer UK. And I'm going to be running this webinar alongside my colleague, Di Cook, who's one of the other patient support officers. So welcome to the session, Setting Up a Support Group for Your Bladder Cancer Patients. The webinar is going to be presented by two nurse specialists along with a patient representative. We've got Christian Silvestre, who's a charge nurse for bladder cancer patients from Frimley NHS Foundation Trust, and Jenny Akins, who's an advanced nurse practitioner from Wolverhampton NHS Foundation Trust, and also happens to be one of our ABC UK trustees as well. Following their presentations, which are going to be about setting up a support group and also how to keep a support group going and sustain interest in it, we're going to hear from Anne Wass, who's a patient with bladder cancer who actually got a diagnosis during COVID and actually has been attending her patient support group ever since then. So she's going to be talking for a few minutes about the benefits she's received from attending. And at the end, we're going to have time for question and answers, and the question and answer function will be open throughout the webinar. So if you have got any questions that you want to put to any of our speakers, please do pop them in the question and answer function, and I will be putting them to the speakers at the end of the session. We'll also actually be telling you about some resources that we've got to help you if you are interested in setting up a patient support group, and all of our contact details and how to get in touch with us after the webinar. That will also be up on the screen afterwards. The session is being recorded, but please rest assured that your cameras, because it's a webinar, aren't visible. And also with the recording, again, your cameras won't be visible. And also the transcript of the question and answer chat function, that also won't be visible during and after the recording. So on that note, I'm going to hand over to our first speaker, Christian Silvestre from Frimley NHS Foundation Trust, who's been running his group since November last year and is getting a lot of interest and a good attendance. Okay, and I'll hand over.
Hello, everyone. My name is Christian Silvestre, and thank you for the introduction. It's my honor to be here and to be invited by the lovely team of Action Bladder Cancer UK. First of all, I'd like to introduce myself, but before I do that, just one disclaimer, all the people in my presentation are not cancer patients. I'm just using stock photos from Microsoft Office. Yeah, like what Jackie said in the beginning. I work at Frimley Park Hospital. I'm a bladder cancer CNS, and so the focus of my role is providing intravesical chemotherapy and immunotherapy to patients. However, I also look after penile and testicular cancer patients. Looking after the bladder cancer patients and cancer patients in general, I really love it because of the patient facing nature of it. And I run the BCG clinic, which is the immunotherapy treatment for bladder cancer, and my patients are really lovely. Next slide, please. So what is a cancer support group? The chapters of my presentation are as follows. We'll define that. Next part will be the benefits of joining and the process of how I launched it with my team in the beginning. And at the end will be the feedback that we've received from our patients. Next slide, please. A cancer support group is a gathering where people affected by cancer can share experiences. And for this topic, we'll focus on the bladder cancer patients. So these patients, like I said, are the patients that I look after when I provide intravesical chemotherapy, intravesical immunotherapy, and also a part of my role is triaging referrals from the GPs for suspected cancer patients. So, as CNSs, we all know how daunting it is to be diagnosed with cancer, and being in a cancer support group is one of the best ways a patient can feel supported because we all know what happens in a histology clinic and the patient receive their diagnosis. There's not enough time for patients to process what's going on, the weight of the diagnosis, and how it will affect their lives. A cancer support group is a good form of emotional support. And apart from that, patients also get practical support from each other. So what I have noticed when we launched the support group, it's really interesting how different people deal with their diagnosis, how they manage the lifestyle changes that comes along with it. And patients sometimes when they're like further along on their diagnosis and cancer journey, they have more experiences that can they can share to those who are just newly diagnosed. And also they talk about coping strategies, mainly about, I think the recurring topic when we meet is like dealing with cystitis symptoms that are associated with BCG treatment, which is the immunotherapy, which is the treatment that we give for non-muscle invasive bladder cancer. And the support group is also a safe space for patients to talk about their feelings, their experiences, and it's a confidential group wherein patients can voice out their frustrations, may it be with the service that they're receiving from their cancer treating unit. So we're really open to that and we encourage that so that patients can speak openly to us. And the patients are very grateful that CNS like us are present for the support group so they can have a reliable resource with regards to their concerns. And ideally, the support group should be in a setting wherein it's away from clinical and hospital settings because environment plays a big role on how the participants will open up with their experiences because that just puts them at ease that they think and feel, oh, this is a totally relaxed environment. I can be honest with how I feel, and I will explain more details about the importance of selecting a proper venue later on. Can we have the next slide, please? The next part is we're going to talk about what actually happens in a meeting. So mainly we have a chat over tea or coffee, and the us CNSs are the facilitator and we guide each participant on sharing their experiences and concerns. So when we launched the support group, we basically started with a conversation on how each patient was diagnosed and their experiences may be positive or negative. And we also had the support of our bladder cancer lead that was present on our pilot meeting, and we really appreciate that from him. And the patients really felt the support and the focus on patient well-being because of that. And so we invite guest speakers on a variety of topics. Like I said, our bladder cancer lead, which is our bladder cancer consultant, was there for the first meeting. And also one of the representatives of Action Bladder Cancer UK, Jan, was really helpful from the get-go of our launch. She was there as well. And she was there to share to the patients the resources that they can access from the charity that is ABC. So we are really grateful for that. Some groups actually integrate activities like art, crafts, musical activities, or sports. But this is for groups that have been together for a while and have really established a continued relationship from the support group. So that sounds like fun as well. And I'm hoping that with our cancer support group in Frimley, we'll get to that point in the future. And the support group does not need to happen in the same setting all the time. From our support group, we mainly meet in a pub in Frimley Park, and the patients really love that because it's away from, like I said earlier, a clinical setting, and they can really let loose. It feels like they're just meeting friends over a cup of coffee and tea. And we can also use a virtual hybrid approach, and so it doesn't need to be confined to one setup all the time. And this meeting is an opportunity for patients as well to ask questions towards the bladder cancer CNS. And yeah, we can go to the next slide, please. There are many benefits of joining a cancer support group. It provides a sense of community to patients, makes them feel they are not alone, reduces their isolation, which is very common when patients get diagnosed with cancer. And in this meeting, they also listen and learn from others' experiences. Like I said earlier, they hear about the journey of other people, sometimes further along and recovering from cancer. So that also gives them hope. And well-being activities. There was a meeting that where when we invited well-being liaison from Macmillan, so patients really loved that. They were provided with exercises that they can use when coping with distress or psychological distress. And also being with people who are going through the same thing, you will feel like you belong and people who are there will understand you, and it's useful for at any point of the cancer journey, maybe the for the beginners, the newly diagnosed, wherein the feeling is quite fragile in the beginning of the diagnosis, or patients who've been discharged from surveillance have fully recovered and doing really well. I've I have a lot of patients who are on that path of their cancer journey, and it's really nice to see that they're encouraging the patients who are just at the beginning. So they're there to support the patients who are just newly diagnosed. And it's a community of people who understands what you're going through, and it's an opportunity for them to make friends as well. Next slide, please. So I'll just quickly go through the process, how it all came about. The precursor actually for us establishing bladder cancer support group was when we had our annual general meeting as a urology team in Frimley Park. We found a need that there wasn't an active bladder cancer support group. So we decided that we should launch one for our patients. But when we were planning for it, we knew from the get go that we shouldn't really put it on the Frimley umbrella only. We named it as Southeast Bladder Cancer Support Group because we wanted it to be open for areas around Frimley, Surrey, Berkshire, so that patients from other centers can refer to us if the patients live close to Frimley, and they're welcome to attend the bladder cancer support group. In the beginning, we started with gauging interests among patients who are having treatment for bladder cancer. We mentioned that if we were to launch a support group, when would be the best day, when would be the best time. So those are the things that we asked, and those who are interested, we documented with their consent their information, so that when we had the logistics in place, we just have all their information so we can easily send out the invites. So that's the planning phase. We started the database. Next one is observing other active cancer support groups. I was really lucky when I was planning to launch the support group. There was an active renal cancer support group that I attended, and I observed a session, and that group is really thriving as well, and I learned a lot from that meeting. So actually the meeting place that they were at is also the same meeting place that we ended up using. So, and network with catchment areas, like I said, other trusts and centers, hospitals who look after bladder cancer patients. We've let them know that they can refer to us for patients needing a support group. And as for the resources, the venue, like I said, was in a pub, and the manager there was really supportive. We have a dedicated space there of 3 tables that can accommodate up to, I think, 20 people. And our attendance is really good. It's around 10 to 15 consistently for every meeting. In the beginning as well, we thought that bi-monthly meeting, every 2 months meeting is gonna be appropriate. And so we meet every 2 months on the fourth Wednesday of the month. And we're really grateful with the Action Bladder Cancer UK's grant for funding the refreshments in the beginning. So thank you for that. Really appreciate that. And I'm sure for anyone here who's planning to launch a bladder cancer support group, ABC UK will be there to support you. And so when we have the information of the patients who want to attend, we send them invite either by email, SMS, and or phone call sometimes when some patients don't do emails or SMS. So those are the resources required. Then when we launch, like I mentioned earlier, we had our bladder cancer lead supporting us, and that was an opportunity for our bladder cancer lead to give updates about the bladder cancer service in Frimley Park as well. Like for example, at the moment, there's research going on with urine biomarkers, so that in the future there's a potential for it to be integrated for bladder cancer surveillance. So when the patients heard about that, they were really thrilled. And yeah, so this is an opportunity for patients to get updates about the service as well. And it's an inclusive space for patients, their partners, and their carers. So continuity of the support group relies on CNS support, which should be continuous, but we're also aiming for the support group to be patient-led. And we are still at the moment in the process of looking for a patient who can be a facilitator in the future. And that meeting is also an opportunity for us to receive continuous feedback from our patients if they're happy about the service, if there's anything that they would like to improve. Or next slide, please. So the after the process, the feedback that we got from our patients are mainly it relieves their anxiety. They're really glad to meet other patients and that to realize that there's so much more patients out there who are going through the same thing. And it also makes them feel supported outside of the clinical settings, which is very limited. As we all know, either the histology appointment, the treatment appointment, it's run on a very rigid and set time. So sometimes when there are concerns that patients have that they are unable to voice out during that time, this is an opportunity for them to do that. And in this setting, they're able to discuss feelings and frustrations freely because they feel like they're just meeting a bunch of friends and having a laugh as well, talking about not just cancer. We keep reminding our patients that when we see them in the support group, we tell them that cancer is just a chapter in their lives and there's so much more to their lives apart from the cancer diagnosis. And that's why it's really important for them to support each other go through this chapter in their lives. And so that's the main feedback that we got, and that it was fun. They really enjoyed it as well. And a lot of them look forward to the time when we're due to meet again. And our next meeting is actually the end of this month. And me too, I'm looking forward to that. So before I end, I'd like to just share the main challenges that I received that we encountered during this time when we were trying to launch the support group. First of all is the imposter syndrome that I felt trying to organize a meeting amongst patients because at this time I was just really new to my role. I was like 8 months into my role and I wasn't fully confident that I'll be able to handle such a responsibility. But with the support of my team, I got through that, and the patients are really lovely as well. So, yeah, they really helped me out. And the second challenge is that facilitating a group, and especially a group of people in a very vulnerable circumstance, is very challenging. It requires a lot of therapeutic communication, emotional situation. So if you are a nurse, CNS planning to launch a support group, you should be ready for situations like that, wherein patient is in a vulnerable emotional situation. And we should have the skills and knowledge in managing that and also dealing with the group dynamics. But we shouldn't go into the support group feeling like we have to be like a therapist going into it. As long as we employ our therapeutic communication and we know when to signpost to other professionals like psychological support, and we have to access those resources when we feel like there's more help that the patient requires in this area. And also, when patients are becoming unwell, we should know when to refer to the community support as well. And last but not the least, I'd like to mention that we should open to learning from patients. In my role, I learn more from patients than they learn from me. I believe that's what keeps my job interesting, because every day I meet a different type of patients. It's really a rewarding experience. And last but not the least, just start somewhere with launching a support group, because in the process we are doing the best for our patients, and being aiming to give holistic approach in supporting patients is best practice according to the NICE guidelines. And in this process of launching a support group, we provide practical help, we provide psychological support, we provide emotional support, and continuous information and communication to our patients. I just like to show you, this is the invitation that we provide our patients to join the support group. There's a QR code there that they can scan and register. We attach this QR code to every letter they receive from diagnosis and to their treatment letters. So even if in the beginning they're hesitant to join us, if they ever change their mind, they have the access to join the support group. And I'd like to end by thanking my team in the bladder cancer team in Frimley Park. Can we show the next slide, please? So that's me on the left. In the middle is Joe Escort, who is our bladder cancer specialist nurse. And on the right is our bladder cancer lead, Mr. Ahmed Ali. Thank you for your time listening to me this afternoon. And yeah, I look forward to Jenny's presentation. She's been doing this a long time. So I'm looking forward to learning a lot from her.
Thanks, Christian. Are you able to put my slides up, please? Lovely. So I'm Jenny Akins. I'm from Wolverhampton. Just skip through the next slide, please. My declaration as follows. Next slide. So just to give you a little bit of background about myself. So I joined the specialist nursing team with Wolverhampton in 2003, and I gravitated to bladder cancer as soon as I joined the team. I had a real passion to improve the provision of care for these patients. So I trained in stoma care, which is quite unusual, and so this gave continuity of care for our patients, and subsequently trained in to follow up patients in a cystectomy clinic and a cystoscopy clinic as well. So had real contact with these patients on an ongoing basis. When I joined the team, we already had a well-established prostate cancer support group, and it was really evident that there was an unmet need for a bladder cancer support group. And this is obviously a goal for me. It did take me a few years to do it, but I was determined to get a support group set up. Next slide, please. Just to touch on how I established my group. So I invited patients to attend a focus group. So we invited 100 bladder cancer patients, well over 100, and 100 turned up actually. That was certainly promising, but I knew I needed help if it was going to be a success. So I asked for volunteers. At the end of the day, this is their group, not my group. I asked for a chairman and a treasurer, and I can truly say I hit the jackpot. I had two amazing volunteers with a wealth of experience. So one was a retired accountant, which came in very handy being a treasurer, and the other one retired managing director. They both had very good leadership qualities and plenty of ideas. It was a good starting point for me. Next slide, please. How should you run a support group? So you should consider setting up a support group, but how to sustain a group is really important, because a lot of people I talk to, the nurses, they have a group, but unfortunately it folds or they don't get very well attendance. So we have an AGM every year, and we re-elect committee members, and we discuss the running and govern meetings. The consensus from the group is what we need and potentially what we need to change. If it's face-to-face, you need to think about your venue. That's really important. Consider parking. Is it within driving distance? We've changed our venue a couple of years ago, much smaller venue. We used to have it in a church hall. We now have it in the hub, which is like a little library. And I think it's a much more welcoming environment, and it's been well received by our patients. Again, you need to think about the times of the meetings. Is this practical? For patients and staff, are you supported by your managers? Think of, is this job planned? Is this an activity and is it job planned for you? And that may determine the factor of whether you can support it or whether you're willing to support it in the evenings. As is held in the afternoon, that's what the patients wanted. They didn't want to be going out in the winter and the night. So we have it on a Monday afternoon. Make it inclusive as well. Have a team maker, have raffle prizes. Think how you're going to financially support your group as well. And then your speakers, ask the patients what they want. We have speakers at our meetings and ideas such as diagnosing bladder cancer, treatments, new advances in bladder cancer, clinical trials, and keep on reviewing this on an annual basis. Our support group are held approximately every 8 weeks. We don't have one in the summer because nearly everybody's away. We have about 40 members at each of the meetings, so it's really well attended. And we have committee meetings in between. So we usually meet at a pub and we have about a 45-minute meeting in between our general meetings. And we have 5 members. They're all bladder cancer patients. And they're crucial to its success. I can't highly recommend having a committee members to support you. So we've got a treasurer, website designer, somebody who organises our social events, secretary. They're all buddies too, so they help to support patients. We raise money with donations, raffle prizes, sponsored events, and this all helps to subsidise the social events such as a Christmas lunch for our patients. And sometimes this is their only outing as well over the Christmas period. Think about doing other events as well, which might help the patients. Each of our committee members eases that pressure on me. So even such as thinking, bringing the speaker to the meeting, locking up, opening up, delegating tasks is really important. And these are my members on this slide here. I've got Jessie, Sylvia, Keith, Gary and Mike, and they're essential to what I do really and how the group is run. Next slide, please. I would say the challenging part of running a group is encouraging new members to attend, but also sustaining that interest in your group. Finding an opportunity to discuss the group and introduce them to the support group. So you need to consider this at whether it's initial diagnosis, a BCG clinic, cystectomy review clinic, or cystoscopy clinic. Advertise this in your clinic rooms, in your departments, on the wards. Also, utilise the national charities will help to promote your support groups and use different formats. Don't forget as well, social media is very good to get the word out. Even if the patients don't use it, their relatives may. Cancer care navigators as well, when they're completing the H&A with the patients, they can talk to the patients about it and post out newsletters or information about it. It can be very daunting for patients to attend their first meeting, so it's essential to greet those patients and welcome them to the meeting. Spreading the word, keeping their in the interest in the group is really essential. And every year I produce a 4-page newsletter, which is posted to every bladder cancer patient at the beginning of the year. It is quite a grueling task for me, but it's so beneficial because it's a way to connect to the patients, tell them about the meeting and the group, introduce them to the department as well. And I've got, I don't know if you can see it, there's one here I've just produced a couple of years ago, but that's the newest one, which I've got on the PowerPoint here. As well as organising a Christmas lunch, I periodically arrange a summer dance with the members, with a band, raffle prizes and buffet. We also meet for a walk in the summer in May to raise awareness for bladder cancer. But it's again, spreading the word, improving morale and interest in the group. And I can't state that enough really. Next slide, please. The secret of the success of my group, the only thing I can say is what we've done really. So ensure the success of the group is establishing that rapport with your patients and their families. Make it inclusive. Try to make new and exciting members feel welcome, and bring bladder cancer patients together to share experience and support each other. And also raising the profile of bladder cancer locally with social events through meetings. But most important factor is improving our patients' care through their pathway. But what I would say is don't underestimate that a support group can be a lifeline for patients. And also it's the most rewarding part of my job is facilitating this group. Once you've got it set up, once you've got a regular attendance, it's really rewarding. And I think it's probably my most favourite part of my role is going to the support group meetings. Next slide, please. So these are just some quotes I told my members that I was doing this webinar tonight, and I said, can you just WhatsApp me some quotes? Because we've got a little WhatsApp group as well. And this is what they came back to me. And I think this tells the story really of what the group is and how successful it is and what it means to the patients. And I think really actually that simple quote there, support groups show that you're not alone. I think that's enough really. It doesn't need to be too long what they say. I think that's enough what they've said there. It's really valuable. And again, these words mean a lot to us because it's so rewarding what you put in. It really makes a difference to the patient. So my advice is keep trying, don't give up. If you're struggling, seek help from the national charities. Diane and Jackie will give you further information in a few minutes about how they can support you. Don't forget as well that bladder cancer is an unspoken cancer, really. There's no media attention, and this can be sometimes the only chance for a patient to meet another patient with bladder cancer. So make it important and make it a priority for you, although I'm sure it's not, but try and make it a priority. And I just thought I'd read this out to you. So I had last year posted, I don't normally get letters from patients, but I had this through the post, so I've anonymised it, but I just thought I'd read this to you as a final note. Dear Jenny, I don't know if you remember me, but I was on the first bladder cancer support committee you set up in 2012. I was diagnosed with bladder cancer in 2011 and I received my treatment locally. I felt very supported when I attended the Wolverhampton Bladder Cancer Support Group meetings and enjoyed the meetings. In February 2013, we moved down south. I was given the all clear, and in 2019 was discharged from urology. We had a wonderful time down south, but we made the decision to move closer to our family and relatives in the Midlands. We'd love it if we could attend the support group again, as we found this so very beneficial. I can see that your group is still thriving, and it would be lovely to see you all again. Would you let me know if I could still attend the meetings? Thank you for listening. I think, is it Anne now?
Yes, hello, thank you, Jenny. Hello, my name. Oh, I'm not on.
Can
Yes.
you are, I can hear you, Anne. So
yeah. Hello, thank you, Jenny. Yeah, my name's Anne Moss, and I was diagnosed during the pandemic in May 2020 with muscle invasive bladder cancer. I had 1 TURBT followed by 3 cycles of intravenous chemotherapy before having my radical cystectomy in December 2020. I now have an ileal conduit, more commonly referred to as a stoma. I remember feeling very shocked and completely terrified about having a cancer diagnosis. And despite having very supportive family and friends, I just felt really alone. I never dreamt I would talk to anyone, let alone meet people in a group setting who were going through a similar situation as me, and how wrong I was. When I was diagnosed, because it was during the pandemic and no support groups were meeting, I actually didn't attend my first group until I was through my treatment and my major surgery. But the thing is, even though I'd gone through months of treatment and surgery and was beginning to adapt to a new life with a bag, I still needed emotional support to get my head around everything that had happened to me. One of the overriding reasons for me to start to attend a support group was recognising in myself that I needed help, and knowing and finding others who had gone through what I'd gone through had a huge impact on my well-being. That feeling of being alone certainly no longer felt overwhelming once I was able to talk to others who'd been in a similar situation as myself. I feel sure that had I been able to attend a group earlier in my treatment path, it would have been really beneficial to me. Our group is a diverse group of men and women of various ages who all understand everything you're going through. And the group provides a vital support network through friendly monthly meetings, and we'd have a WhatsApp group chat as well. And you always know there's someone willing to offer a friendly voice at the end of the phone should you need it. I don't think anything can beat talking to someone who really understands what you're going through. And our group welcomes everyone, including partners, carers and family, as a cancer diagnosis affects everyone around you. Just a little bit now about our group meetings and how ours are run. As others have said, the venue needs to be a safe space to be able to talk. And we're very fortunate in that we have a private room at a local golf club that they give us free of charge, which we are hugely grateful for. We always have teas and coffees and delicious cakes and biscuits, usually made by members of the group. And we also have 2 urology nurse specialists attend our groups, and we're always grateful for their support and advice. We actually meet in the evenings from 6:30 till 8. This is primarily to ensure that the meetings can be accessible to those that are working, because we do actually have quite a few people who are still working age in our group. We set our meeting dates in a year in advance, and these are circulated to patients via the urology clinic. And we also, members, put up posters in our local GP surgeries advertising our group and including contact telephone numbers, because some people like to have a telephone number to ring first before they actually, rather than just turning up unexpected. Our group tends to sit in a big circle, and we tend to have a short welcome, any messages, and then generally the floor is open to anyone who wants to raise anything. We do have guest speakers come along. We've had a couple of our consultant surgeons, we've had a counsellor, we've had our own urology nurse specialists give an insight into their working day, which was hugely interesting. And we've also had our own group members giving a short talk about their own lived experience. Usually, roughly about halfway through the meeting, we'll break so people can chat in smaller groups or perhaps on a one-to-one basis. We recognise that support groups are not for everyone, and it takes a huge amount of courage to attend a group, but hopefully all of our smiling faces will welcome people and will put people at their ease when they come into the room for that very first time. And we often say at our group when new members join that no question is a silly question. And this hopefully gives people the confidence to ask questions without fear of judgment. We always have a laugh too. This is so important, especially when we're talking about our bodily functions, and we do genuinely have a laugh. So what do I still get out of the group? I've been attending now for 4.5 years. I really enjoy helping and supporting others who are diagnosed with bladder cancer. It's nice to be able to show new patients that actually there is life post-diagnosis. I enjoy talking about my experiences of living with a urostomy and having a very positive outlook on life with a bag. I'm actually very proud of my stoma, and hopefully my experience can reassure others that there is a good quality of life to be had post-treatment. I've also made some very good friends in the group, and I know our paths would never have crossed had it not been for our bladder cancer diagnosis. It's the silver lining to what was once a really dark cloud. Thank you for listening, and I'm now going to hand you back to Di, our ABC UK Patient Support Officer, who is going to put questions to the speakers from the Q&A chat function.
Thank you, Anne. Thank you, Christian and Jenny. Please, if you have any questions, do put them into the chat now, because we have got quite a bit of time to do that. So it would be great if you have any. We've got a couple already. If Christian and Jenny are happy to join us on the screen as well, that would be great. Hi. Hi, Christian.
Hello.
Hi. So we've got a couple of questions. How do you manage to fit the time into your schedule, and is your manager supportive?
Yeah, on my end, my manager's really supportive, and the good thing in my team is that there's 2 bladder CNS, there's 2 of us, so Sometimes when we have managed to finish everything urgent, we can both go attend the meeting because we always look forward to seeing our patients. But there are times when just one of us is present, and I think the patients are happy as long as there's one of us that will be there who can answer their questions and can be a reliable source of information.
Yeah, I'd say that my manager's very supportive, and luckily we've job planned this, and usually one of the CNSs will go to the meeting, and usually a cancer care navigator as well. But they see it as part of our role, so facilitating this group to ensure that it continues to run smoothly and efficiently. And like I said, there is a need for this group to continue to run. Yeah, I'm very well supported, luckily. I know that's not the case for a lot of CNSs. And that's why it is important to consider the time and whether they're willing to put time in the evening or whether they're allocated time in the afternoon. So I think that is a discussion to be had with the managers, maybe even prior to setting up the support group, so you can work out how you can facilitate the meeting moving forward.
Brilliant. Thank you. We did have one about the best time of day to do it, but I think both of you did touch on that.
Yeah, and I think that's an individual thing. It's about asking your patients like what ANDAs they have theirs in the evening. That works very well for them. Our patients wanted it in the afternoon. So I think it's a questioning, asking those questions again at the onset or changing it, reviewing that on an annual basis and tweaking the venue, tweaking the time if it's needed to be changed. So it suits the needs really of your patients.
Brilliant. We've tried to relaunch our support group 4 times. We just don't get the take-up of patients. What was the key thing to make it successful?
Do you want to go, Christian, and then I'll go?
Yeah, in our situation, because we launched this support group last year, like I said in my presentation in the beginning, is that we just gauge the interest of every patient. We try to offer it to everyone. But I think Anne mentioned this in her about what she shared, is that really for some people they're not into that, and they'd like to deal with their diagnosis on the not on their own but with their family, and they're not very comfortable. I think in this situation an option can be that maybe it's the element of facing people physically. There's actually research that shows for men who are diagnosed with cancer, they prefer virtual support groups. So that can be an option, because I think in that approach they might be more open because they don't see the people face to face. So I don't know if that's appropriate from the in the situation of the question sender, but that can be an avenue that they can explore. And also, yeah, just speaking with the patients. Maybe it's just the timing, maybe it's just the where the meeting will happen. So yeah, maybe consider their preferences, like Jenny has mentioned earlier.
What I'd add to that is as well is it might not be the right time at initial diagnosis. It might be they do want a buddy straight away. It might be that it's too much information to take on. So actually reaching out at a later date and using clinics when you see the patients for their flexible cystoscopy or their reviews. That might be a way of introducing the support group, because sometimes it's not until after the treatment. They're so focused on the treatment plan, and that's their goal, to get through the treatment. And actually it's afterwards when the actual psychological impact of the cancer and the treatment hits. And maybe Anne could add to this as well in a minute as well. But it's actually just finding a way of connecting to your patients, but also getting volunteers, because if your volunteers are your patients as well, that's an encouragement, because you're going to have a group that attend all the time. But don't give up. I found the first 18 months was really difficult. We had maybe 5 or 10 came, but keep on going with it. Patients will utilize it, but it's using your judgment of when to introduce a support group, because it's not always great at the beginning. But I can ask Anna her opinion on that.
Yeah, I think I would have found attending a support group earlier in my diagnosis, particularly I think when I was in the run-up to waiting for my radical cystectomy. I think at first, I think you're absolutely right, Jenny. For me, I my head was just full of everything, and I wouldn't have been able to have accessed a group at that point on that initial diagnosis and going through the chemotherapy. I wouldn't have been in any fit state, I don't think. But I think as I came through my chemotherapy and was waiting for my major surgery, I think at that point, had it been available to me, it would have been a good point. So I think that's right. It's where you are in your path, if you like, as to how you might access the groups. And I think the main thing is that the groups always run on the dates that are advertised, because if only one person turns up, then it's still worthwhile, no matter how small. Our group, it fluctuates between, can be as few as a dozen up to 30 or 40. So people dip in and out sometimes. Yeah.
I agree.
Which kind of leads on to the next question as well. So you might want to continue, Anne, or Jenny or Christian take up. But it's to ask whether it's good for people at different stages and receiving different treatment to be in the same group, or whether it's worth considering having separate groups for people who are having different treatments. So for patients who are post-cystectomy. So I don't know whether you, could elaborate on that. I think you've touched a little bit.
I don't know. I think personally, trying to split a group into different sections would be pretty tricky. And actually, as you get to know everybody really well, and when new people come in, then those of us that are through and out the other side, if you like, we tend to sit back and obviously listen and try and then help that person. But when we break in the middle and people go into little groups, they tend to find the people who are perhaps going through maybe BCG or whatever. I think it would be difficult to just have a group for newly diagnosed, a group. It would be I don't know. That's my opinion. Yeah.
I would agree with you on that, because again, you're talking fairly small numbers. Even my group, it's 40 at the very most, really. So if you were going to then separate that for BCG, cystectomies, and generally that tends to be the patients that utilise the group, is those group of patients. I think, again, it would make the group smaller and difficult to facilitate, because you're probably talking more and more meetings. But actually, our patients connect with whatever treatments they're having. They do talk to each other, they connect, and there's friendships in there. Yeah, you do find sometimes the cystectomy patients tend to navigate a little bit together because they've been through the same process, but they all get on really well. And I don't foresee I'd ever change that with mine unless it was needed, but that's my viewpoint on it. And I've never done that in the past at all. It's always been inclusive.
Brilliant. And good to have a mix of men and women as well, or do you?
Yeah, definitely.
And again, I think that doesn't seem to be an issue with my group. I don't know whether it's the same with Christian and Anne's. It doesn't seem to be an issue with having mixed men and women. They seem to
in the beginning, in our support group, there were very few female patients attending. Actually, the second meeting, we only had one female patient, and that was her first time attending, and she was asking, is this meant to be just for men? And I was like telling her, no, there was another female patient on the previous meeting, but you just missed her. And like I said, it's inclusive for everyone, male, female, patients with muscle invasive bladder cancer, non-muscle invasive bladder cancer. But from our experience, there is a situation where it can be tricky with muscle invasive bladder cancer patients at the early onset, that they've just received their diagnosis, they're awaiting surgery. And I think Anne touched on this earlier already. I think there are times when the diagnosis is fresh, it's not appropriate for them to be mixed with non-muscle invasive bladder cancer patients, because there's a tendency for them to compare what they're going through with what others are going through. So what I think what we learned from that experience is that we wouldn't we'll make sure that there'll be more than 2 muscle invasive bladder cancers patients in a meeting. Yeah.
I don't know whether as well in Christian or Anne, whether you can, we have partners that attend as well. So it's not patients. Some of the women are partners of patients. So they actually find it very helpful because they get the support as well. Some of the patients prefer not to attend, but their partners want to attend. So they want to be informed about bladder cancer and they feel that they're supported actually. Again, keeping it inclusive really and offering that to carers and relatives, isn't it? But yeah, we've got a few that regular attend and actually they're partners.
Yeah, I agree. Our group includes everybody and lots of people bring their partners along. And actually sometimes I think it's quite helpful, particularly when a new patient might be coming into a group setting, that they've got that somebody there to hold their hand. And that's a nice thing. And as Jenny said, their partner then learns an awful lot more as well about what the treatment and the diagnosis is all about when they start chatting to others. So I think it's really beneficial for all to attend if they want to.
Yeah. And if it is an online group, do you encourage people to keep their cameras on?
I've never done mine online. We discussed it during COVID, whether they wanted to, and they didn't. We did have a quick WhatsApp chat with the committee members, but we actually stopped the meetings because they prefer the actual contact. They prefer the tea and the chat, and they didn't want to go virtual. So we did ask that question, but we've always kept it face to face.
Okay. And you mentioned, Anne and Jenny, you mentioned WhatsApp groups. Jenny, would you be involved in the messaging between meetings as well?
The committee members, we've got a WhatsApp group, so it's really helpful. So we can say when we're meeting for a committee meeting. We don't have one for the whole of the support group, but we do have, the patients do have contact. We can call the patients if there's a change in an event or anything like that. We can get in touch with them. But the WhatsApp group is for the committee, just for us to keep in touch with each other, really. So that's really helpful. That's very helpful.
Okay.
I was just going to say our WhatsApp group is patients only, and it's offered when new people join. Would you like to be part of the WhatsApp group? Occasionally it's really quiet, then sometimes someone might put on a funny joke if it's leading up to the next meeting. None of our Leicester urology team, obviously their staff are not on that WhatsApp group. That wouldn't really be appropriate. But we have our sort of patient-led lady, Suzanne. She liaises with the Leicester team in the run-up to the meetings and then delivers the messages through the WhatsApp chat. So that it's useful. It's nice. It's nice to have it there.
Yeah, it sounds like it. Last three, because I'm aware of time now, so we still do have three. What other guest speakers have you used other than consultant urologists, oncologists?
So I've used psychologists and histopathologist, radiologists, so talking about scans. I've had a registrar talk about MDT. That was really helpful actually, about the MDT meeting. What we do at the MDT, our patients are discussed and our decision makings are made for plans of care, because patients are completely unaware of what happened at an MDT. I'm trying to think of what else I've had. I'd have to go through my newsletter. And then national charities like yourself, like Bladder Cancer, ABC UK, Benefits Macmillan, they come. Compton Care, which is our hospice as well, they've come and talked about what they provide. Lymphedema team. So it's endless really. You can utilise anybody that's involved with the patient. And I know some groups that don't even have discussions about bladder cancer. It can be, like you say, like Christian says, arts and crafts. It can be an activity. It doesn't have to be about bladder cancer. But my patients wanted the discussions about their cancer and to enhance their knowledge about their diagnosis and treatment.
Brilliant. Okay, next one is, do you have many patients with metastatic bladder cancer who attend? We know that these patients often have a very poor prognosis.
I have had a few patients that have attended. It isn't taken up so much by those group of patients because they go to oncology, and I think that they actually are quite inundated with appointments and treatments, and it depends on how well enough they are to attend as well. But I have had a couple of patients that come in the past, but I would say the biggest uptake in the meeting in Wolverhampton is cystectomy patients and BCG patients. I should say, I've had a few patients that have had previous treatments or they've been discharged and they still want to attend. But in general, it's that cohort of patients that tend to come to the group.
Okay, last question. Do you cover different languages and cultures? Has that ever been an issue for people wanting to attend?
In the beginning of our support group, we had a patient who was Nepalese, and the approach that we planned for the patient if he were to attend was that we will invite him along with his, I think it was granddaughter, and the granddaughter will be able to translate what the group is discussing. So that was how we addressed the language barrier. But definitely we sent the invite even if the patient does not speak English.
Great, thank you. Thanks, Christian. That's the last question. So I just want to say a huge thank you to all three of you. It's been amazing, so thank you.
Thanks.
Thank you.
Di, have you got the information about how you can support the support groups as well? Yeah.
We have. So yeah, we're now at the end of the session. So yeah, I've just said a huge thank you to the three of you, which is the most important thing. We do have a new resource for nurses on how to set up a patient support group and how we can support you to do that. So we will be emailing that to all participants, and please share with your colleagues. We can send more out. We have also recorded the session, so that will be available on our website as well. We will be including our survey in the email, and we really encourage you to complete it, please, because it helps us to shape our education program for you. So it's really always great to get your feedback. Check our website. In a little while at the end, we're going to put up our information details, so please stay on if you want to take that down. Check our website for the events, nurse education events. It will tell you about the webinars we've had, what we've got planned, including our annual Nurse Education Day, which takes place every September in Birmingham. So all of that information is on the website, plus all of our resources, and we can send those to you free of charge. So just let us know if you would like us to do that. So it's just left for me to say a huge thank you for joining tonight. We hope you found it beneficial. If you do have any questions after the session, please do just email us at the email address that's going to come up in a second, and enjoy the rest of your evening. So thank you.